Alright, back again. Now we're talking about cognitive behavioral therapy for panic disorder. This is a little bit more than standard exposure, and I'm going to talk about exposure in a couple of slides when I give you some graphs comparing different treatments. But in full-out CBT, clients are first taught relaxation and breathing exercises. So you're taught how to actually relax your muscles, whether that's progressive muscle relaxation or something else. And the clinician guides the client in identifying the types of thoughts that they have when they feel the physical sensations that make them nervous. So when they feel their heart rate increase, what are they thinking? I'm having a heart attack. I'm going crazy. I'm losing control. They identify what are the thoughts they're typically having. Because those thoughts are then a target for treatment. You can say, well, what's the evidence for and against that? The client then practices using relaxation and breathing while experiencing panic symptoms in session. Now, that doesn't mean you actually induce a full-out panic attack, but it means that you are going to try to get someone really anxious. And so our treatments for anxiety are actually really successful and very powerful. But an important point to keep in mind is for treatment of anxiety disorder to work, I have to make you anxious as your therapist. So as this is going on, the therapist challenges the client's catastrophizing thoughts about bodily sensations and teaches them how to do that themselves. Because remember, the therapist is a trainer, not a wizard. You're not instilling some great insight. You're just teaching them a skill that they can use outside of the session. And the therapist then also uses systematic desensitization, so gradual exposure to the items that an individual fears. So if you create a fear hierarchy, so from 0 to 100, each of these things would cause me such and such amount of anxiety, we would then target the things in the middle of your list. Some of the types of behavioral things that we'll do in these treatments include intentional hyperventilation, spinning in a chair, straw breathing, holding your breath, running in place, tensing muscles. There are all sorts of things that are really simple, but can actually induce those same physical sensations and be very effective in treatment. Okay, slide 22 is the slide I've hinted at a couple of times. If you look at it, you see this is a comparison of a bunch of different treatment approaches in the treatment of panic disorder. And the y-axis is the percentage of the sample reporting no panic attacks at all. So you see pre-assessment or pre-treatment and post-assessment, post-treatment. There is a group of folks who were on a wait list, so nothing happened to them. There's a group of folks who only received training in relaxing. There's a bunch of folks who only received training in exposure or cognitive approaches. And there's a bunch of folks who got combined exposure and relaxation. And you'll see that the best response rates were from exposure and from a combination of exposure and relaxation. But what you'll also notice is that exposure alone was no worse than exposure with relaxation, meaning that giving someone relaxation skills when you're treating panic doesn't help at all. Now, some people say maybe it won't hurt, and that's true. There are times where it probably doesn't. But there's also some folks who say that it actually can be somewhat harmful, and the next slide we'll talk about backs that up. If you look at slide number 23, the folks in the purely exposure group perform much better after treatment than in folks who got both exposure and relaxation. So normally I would say, why do you guys think that is? In an 8 a.m. class, admittedly, people might sort of stare blankly and shuffle their feet. We'd have a nice little awkward silence together. So again, I'll just have to sort of tell you, since we're on a video here, and the idea is that if you are learning how to relax every time you face your fears, you might have a safety behavior, like the iPod example I gave you earlier on. You don't actually engage in the environment around you. You're still just as fearful as it was before, but you've learned a technique to get you through that fear until the situation's done. Whereas without relaxation skills, if you're just exposed, you're forced to sit with it and actually learn, take in new information that tells you this isn't actually all that dangerous. And if it does go as poorly as I thought, that outcome isn't going to be as bad as I feared. And so the actual learning process could be hindered if you're using relaxation to keep from actually directly engaging in the material. Okay, so that's panic disorder. And again, I will be back in class before too long, and I will go over these slides with you if you have questions, whether that's through email or in class. So if you're feeling a little bit lost, that's fine. But that's all I have on panic. We're going to shift gears to specific phobias now, and I don't have nearly as much to say on this topic, because they're really pretty straightforward. Specific phobias are simply fears of specific objects, places, or situations. You'll notice on slide 25 there are 3 links. These are links to 3 parts of a YouTube video that show a very intensive behavioral treatment of a snake phobia in a woman. So you watch 1-day treatment that's extremely successful. The video features David Barlow, who's probably one of, if not the world's most preeminent anxiety researcher and clinician up at the Center for Anxiety and Related Disorders in Boston. And you'll also see Lars Goren-Ost, who's another very sort of prominent researcher and clinician, and he actually performs the treatment in these videos. So it's 3 parts, but it's actually one video. It's just, again, YouTube has a 10-minute limit. I highly recommend you watching it. Obviously, I'm not going to quiz you on a video, but this video will give you a much clearer sense of exactly what I'm talking about, and let you learn a little bit. Okay. Diagnostic criteria for specific phobias. First is that you need to have a marked and persistent fear that's excessive or unreasonable, cued by something specific. So you have a very, very strong, sort of overly strong fear response to a very specific thing or event. And exposure to this causes almost invariably an immediate anxiety response that could be as extreme as a panic attack. Or in children, you might see crying, tantrums, freezing, stuff like that. But basically, you have a really strong fear, it's there all the time, and when you're in the presence of this object, you really freak out. If you move on to the next slide, you see the person recognizes the fear is excessive or unreasonable. Children don't necessarily have to have that, but in adolescents and adults, they realize, I shouldn't be as afraid of this as I am, but I am, and so I need some help overcoming this. Phobic situation is avoided entirely, or it's endured with intense anxiety or distress, just like in panic disorder. The avoidance, the anxious anticipation, or the distress interferes with your life. So again, if you have if you have a phobia of milk, but that doesn't really impact your life very much, you might not need to do anything about that. But if it's causing extreme distress in your life, well, then that's a bigger deal. And then the last symptom on here is that if the individual is under 18, it must last at least 6 months. And so keep in mind that kids have phases. They become afraid of things for months at a time, and then it goes away on its own. So it's not that it would hurt them to get treatment, they might not need it. And so the idea is we're not trying to label every single fear as an anxiety disorder. We're simply trying to say things that are extreme and they hang around for a long time. You'd probably benefit from treatment because we're actually really good at it. There's a bunch of different subtypes of specific phobias, and they're pretty clearly named. The animal subtype, your fear is about animals, and that typically has a childhood onset. Natural environment type, it's about natural environment phenomena, things like thunderstorms or heights or water, and that again also typically has a childhood onset. Your situational type, it's particular situations, so things like public transportation or bridges or elevators or flying, and that one has a bimodal peak, meaning a lot of folks get in childhood, a lot of folks get in their mid-20s. Those are the most common ages of onset. The blood injection and injury type is, what it sounds like. And then the other type is a sort of catch-all category for things that don't fit in those other categories. It could be something like clowns, that's pretty common. It could be something weird like costumed characters. It could be something like vomiting or choking. In all honesty, costume character phobia would be like my dream client, just because it would be fun, because treatment would involve basically first taking them to see people in costume outfits, and then maybe me, jumping into the therapy room. That's when maybe I would do a therapy session dressed as Tony the Tiger. Who knows? But it would be very fun, for me anyway. Some stats. Specific phobias have a 1-year prevalence rate of about 4.4%, with the typical age of onset in childhood or adolescence, and women are twice as likely as men to develop it. A couple points to keep in mind. One is that everybody, children have fears. They have a lot of them. It's a natural part of childhood. The number of fears tends to decrease with age, but the complexity of fears tends to increase with age. A lot of children, again, have periods of time when they're vulnerable to stuff like this. I'm not going to go over the little Albert thing here. I'll go over it in class if anybody has questions, but your book explains it well. I just put this slide here to cue you to read it. And so the last slide is just about treatment, and treatment really isn't any different here than it is for panic. You're not exposing someone to physical sensations. You're exposing them to the item that they're afraid of. So in class we're going to talk about exactly what that treatment looks like, but I really encourage you to watch the video that the YouTube clips are on, because they give you a really clear example of what exposure treatment looks like. It's not some scary, unethical, bad thing. It's a very effective and quick treatment that makes anxiety go away and very often never come back. So if you guys have questions, we'll go over these things in class and you can send me emails. But for now, this is lecture number 1.